Everybody. Welcome to today's Research America Alliance discussion. I'm Eric Strauss. I'm the head of the Health and Medical Reporting for ABC News, and it's an honor to be your moderator today. For the next several weeks, Research America will be hosting Alliance discussions featuring some of the honorees of the 2025 Advocacy Awards. I'm really looking forward to this conversation. First, I'd love to thank all of you for joining us today. I could tell we already have a huge audience joining the chat. And I'd like to thank you for your partnership in the Research America Alliance. I'm very excited to introduce today's special guest, Elizabeth Cohen. She is the recipient of the Research America 2025 Isadore Rosenfeld Award for Impact on Public Opinion Award. I personally have always appreciated Elizabeth's reporting, mostly as a competitor, but also as a consumer of medical news. Um, I noticed that she always brings an extra level of effort and creativity in making her reporting relevant to you, the audience. As a medical journalist, Elizabeth has dedicated her career to helping Americans become smarter, more empowered patients by sharing impactful, real life stories. Um, After nearly losing her own life following the birth of her first daughter, Elizabeth made it her mission to help others navigate the often complicated and overwhelming medical system. Today, we're here to discuss her passion for empowering individuals to advocate for themselves during life's most challenging medical moments. We are both children of doctors, so we are not against the health system and the bureaucracy that it brings, but we know an empowered patient can help themselves and the overall health community. So before we get started, I'll quickly remind our audience to please type your questions into the Q&A box, the chat below, and we'll try to get to as many questions as we can at the end of our discussion. So far we're doing great. I want to thank you for joining us today, Elizabeth, my friend, and it's an honor to have you with us.
Eric, it is an honor to be here. It's an honor to be at a Research America event. It's an honor to receive this award. And I'm so thrilled to be here with you because you are a force in medical journalism, my friend, and a fabulous person. Both of those things combined. So it's wonderful to be here with you. And thank you for doing this with me.
We're off to a good start as long as we're nice to each other. I think it's going to go great. Um, the first question I have to you, we talk a lot about our kids. I know you're a very proud mother of four very healthy daughters, but tell us how your birth experience started off your journey to being an advocate for patients.
So my birth experience, or I should say my pregnancy experience with my oldest daughter, started out great. I had a textbook, wonderful pregnancy. Everything was fantastic. And then at week 33 or 32, so 8 weeks before my due date, I was diagnosed with severe preeclampsia. I was very sick. They had to deliver the baby, my oldest daughter. Before I tell you all of this, I want to tell you she's fabulous now because I never want people to worry as I'm telling this story. She was 3 pounds when she was born. She was in the NICU for a month. And after you deliver the baby, when you have preeclampsia, is typically when things start to get better. But I actually started to get worse. I couldn't open up my eyes. I couldn't move my arms or my legs. I was very confused about where I was and what had happened. And the doctor told me I was anxious and put me on anti-anxiety medication. As I got worse and worse, my husband saved my life. He, to make a long story short, went to the nurse's station and said, something is very, very, very wrong with my wife. You need to have someone come see her right now. And so a specialist came in, a high-risk specialist came in, and she said, I think you are having a reaction to the drugs that we have to give you called magnesium sulfate when you have preeclampsia. And you need an antidote and we'll take a blood test and see. And after which she came back and said, I had to give you the antidote and I had to give you 5 times more, a 5 times higher dose than I've ever given anyone in my career. And this was someone who had a 30-year career at that point. And so what I learned essentially was that my levels of magnesium sulfate were not being monitored. And so it got out of hand. And I had had terrible kidney damage at the time. And so that was part of the reason why this had happened. And I could have been hours away from dying. And it was only because my husband really basically made a scene that we got that high risk person in there. And it really taught me, Eric, you mentioned we're both children of doctors. And I love doctors. This 3-pound baby is now in her first year of medical school, actually. And but mistakes happen and people forget things. And this was a busy doctor who thought I was just anxious. What I learned is that you need to you sometimes need to advocate for yourself and empower yourself in these kinds of situations.
Um, since that experience, I know you've made it your life's work to tell these stories of people who advocate for themselves. Some of my most memorable stories about you involve family members or individuals speaking up for themselves. Do you have any favorite stories or stories that stand out in your mind?
There have been so many of them, Eric, and I'm so honored that people will tell me, will share their stories with me. I think the stories that stick with me the most are the stories about what parents do for their children. So, for example, a boy broke his leg, had a very routine operation in the hospital, and his father was a doctor, and his father said, I think he's developing an infection, and this could become septic very quickly. No one listened to him. And he, sort of like my husband had to, he really had to make a scene in order for anyone to pay attention and get his son the treatment that he needed for what could have become a very bad infection very quickly. So his story always stays in my mind. There's a woman whose child had cancer. And they had a shortage of her cancer drugs, which is all too common these days. And she not only found the drug at a hospital across the country for her daughter, but she started a whole network to get drugs that are in shortage for people who need them. So she became an empowered mother, not just for her child, but for other patients as well. And I think one of my truly most memorable stories was a family in Florida. She they had a child who had was born with a severe neurological issue, and she could never get Medicaid to give her the medicines that she needed. She had to beg for enough seizure medication so that she could give her child medicine when she had a seizure. She quit her job to become an advocate for her daughter, and then as things got worse, they actually left Florida and they went to another state that they had heard had better services for children like their daughter. So they were so empowered that they actually researched and found a better place for their daughter to be.
Break it down for us, like some of us that aren't maybe as confident as others. How do you thread the needle? How do you be that squeaky wheel and not upset the person whose life you're putting in their hands? How does the average person really speak up for themselves and make sure they're being heard?
You're right, Eric, because that really is a delicate balance. And you don't want to overdo it, and you don't want to alienate the people who are saving your life or your child's life or your spouse's life. I think that the best way to do it is to start out always being polite, to always be kind, to always be nice, to always realize that sometimes doctors and nurses are overloaded, and to always be polite, but then to be firm and to continue and to not stop. I think, most of us are nice people. And we're not, psychopathic. We don't want to, make anyone angry. We want to get along with others. And so our instinct is to get along. And almost always a good instinct. But when you're really feeling like you're in danger, you have to be aware you have that instinct and you have to sort of act against it to some extent. One line that I learned from a doctor at Johns Hopkins was this. His wife was pregnant. She had pneumonia. She was in the hospital. She was very sick. And a doctor came and gave her medicine by a pill. And she took the medicine. 5 minutes later, a nurse came in and gave her the same medicine by IV, was starting to give her the same medicine by IV. And her husband who also a physician, said, I think they just gave that to her. They said, no, 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 no. And they proceeded to keep giving to her. And the doctor said a line that I think is pretty brilliant, and I know has helped out many people I know when I've shared this, is, could you please double check? Because if something goes wrong, I don't want this to be on your shoulders. If something is wrong and this is a double dose, which could harm her, I don't want it to be your fault. So I know you're so busy and we're so grateful for everything you've done for us. But if you don't mind just going and checking the records. And he reported to me that the nurse came back and said, you're right, that would have been a second dose. So I think that line, when you feel like something's going wrong, to say to a medical professional, something's wrong and I don't want this to be on your shoulders. I don't want this to be your fault. Can we sort of slow down for a minute and talk about this?
Wow. I hope everybody wrote down that phrasing. That's really powerful. Something you and I have talked about conferences and over coffee is how hard like the gender differences might be, or racial differences. Do you have any advice about that if you're how to navigate? I mean, it's a big life question too, but what if there's differences between your background and the healthcare provider?
That's a great question because often there is a difference. And I just published a story a few weeks ago in the Washington Post about a Black woman who, after giving birth, she just started bleeding profusely, and she knew that something was wrong. She knew this wasn't right, and she couldn't get anyone to pay attention. And she had been taught, she had a nurse, she was in a program with a nurse who was teaching her, various things about pregnancy and childbirth. And that nurse said, you're a Black woman, and Black women often aren't listened to. There's various studies that show that. So you should know that you are going to have to be louder. You are going to have to not give up. So she didn't give up. She kept pressing it. Her mother was with her. Her mother kept pressing it. And it turned out that she was in big trouble and she was having a hemorrhage and they had to rush her into surgery. But if she hadn't stood her ground, she might not have survived that incident. So I think, when I started this work 30 years ago, I think that it wasn't okay to say, you know what, sometimes people don't listen to women, or sometimes people don't listen to Black patients, or sometimes people don't listen to Black women. Now it's not only okay to say it, but there's various studies that show that it's necessary to realize that you're in that situation and you might have to push even harder.
We've talked a lot. This has been your life's work. You've been reporting for over 3 decades. Um, what have you seen change in the landscape over those 3 decades?
I think I've seen a lot of changes for the good. I think when I started this, when I started the empowered patient work that I did at CNN, I think the feeling was that there was a couple of us doing this and we were kind of pushy. And we didn't like doctors. And I always tried to make clear this is not about being against doctors or nurses or hospitals. In fact, some of the people who most advocate for being an empowered patient are doctors and nurses. But back 20, 30 years ago, it was not as okay of a thing to say as it is now. I think some people sometimes were gaslit and were told, no, you don't need to listen to your doctor. Like, why are you worried? You're just anxious, kind of like I was at the birth of my first daughter. And now I don't think that happens. I think people get it, that this is the medical system in this country is wonderful, but it is also imperfect. And that sometimes you have to be the one to catch mistakes and you have to be the one to press things. So I think that's one way it's changed. And also just the advent of the digital world. I mean, there was no internet pretty much when my daughter was born, and certainly was no social media at all. And that has improved things greatly. I mean, you can find things out. I remember having to go to the Emory Medical School library to learn things because that was the only place you could find the New England Journal of Medicine or whatever. But now, everything is at our fingertips, and social media is there for you to connect with other people. I'm not saying it's perfect. The internet is full of all sorts of things that aren't true. Social media is full of all sorts of things that aren't true. But I've always been just so impressed with how patients, no matter what their education level, they get it. They learn how to do this kind of research because it's their illness or it's their child's illness. So to me, the changes have been not 100% for the better, but I think that things are much better than they were 30 years ago.
Empowerment on one side, misinformation, it's like a balancing scale. Do you have any advice for people, well-meaning people who want to do some of their own research so they're informed when they go to talk to their healthcare provider? How can they tell if an Instagram post is true or an article in a national newspaper? Do you have any like quick tips for some of our audience, how they can decide if what they're reading is fact-based?
Well, everything on a reputable site like ABC News is true and correct. So that's the start, is choose reputable sites. And I think people understand what that means. Um, I think it's also really important to have a doctor who is happy to discuss these things with you. I have seen doctors, even, I mean, a lot back in years ago, but even so now, where you ask them a question or you say, I read this, or another patient with this problem told me this. And recently I had a doctor who said, well, why are you listening to that? And, da, da, da. And I got rid of him. I mean, frankly, I just stopped seeing him. On the other hand, I have a wonderful family doctor who, no matter what I raise, he is happy to discuss it. So get yourself a doctor who is happy to discuss it and who's not going to put you down if you bring up things that you read on the internet or on social media. So that's important. And also, I think, people are smart and you can pass the sniff test. If something sounds, like it's just too good to be true, it probably is. If some website you're reading suggests some crazy treatment and the Mayo Clinic doesn't mention it and the Cleveland Clinic doesn't mention it and CDC doesn't, no other sources mention it, that's not a great sign.
I think that's all like really awesome advice. I often tell people like if there's going to be a cure for cancer or some huge news, the large outlets are going to look into it. So I would definitely, before you change the way you live your life or what you consume or things that you try, I think it's really smart to try and look for more than one source. Like there will be a day when some amazing breakthrough comes through and somebody has to be first, but I would look for a little bit more consensus before you start changing the way that you're living. I hope you agree with that.
I completely agree with you. And I think another thing, you made me think of something else, which is it depends what you're talking about. There have been families that have decided, their child has leukemia and they don't want to do chemotherapy. They want to do some herbal treatment they saw. Well, that's a big problem because chemotherapy is extremely effective for childhood leukemia. And herbs are not. So that's a real problem. But to use another example on the other end of the spectrum for myself, I had laryngitis recently, and my mother-in-law told me to warm up some whiskey and put a little honey in it and drink that, and it would coat my throat. So I did. I figured I can't hurt anybody, right? I mean, it's you have to think about what's wrong with you. Is it laryngitis or is it cancer? And is it avoiding a fabulous therapy, a great therapy, a proven therapy, or is it just trying something like, oh, I'll try some warm honey with some whiskey. Let's see what happens. It didn't work, but you know.
Oh darn, I was gonna tweet that out. No,
No, no,
didn't
no,
work?
didn't
Okay.
work, but I figured it didn't harm me either. I wasn't driving a vehicle, so.
Cool. I'm wondering a lot of times, on one end, you're telling patients to be advocates for themselves, and on the other end, healthcare professionals, public health officials, nurses, doctors, CEOs of hospitals are your sources. What do they tell you? What's the feedback you get about your reporting?
Back in the day, the feedback was, I mean, I got a lot of grief. I won't sugarcoat it. I got a lot of grief saying, why are you telling people not to trust their doctor? And I always said, that's not what I'm telling people. Nowadays, the feedback from CEOs and doctors and nurses and leaders in the public health field is very positive. I think because many of them have had experiences, but, doctors are patients too, or doctors are, their family members are patients, and they've had to be empowered. So the feedback that I have been getting more recently is very positive, with all the caveats that you still want to trust what your doctor is telling you while you're also asking questions. We have to all get this ability, maintain this ability to listen, but to ask questions as well.
I feel like we're real excellent multimedia professionals, you and me, because we were like right on time here. Before we turn it over for Q&A, I'm just wondering if uh, you can leave the viewers with our audience here with like one message. What would it be?
One message would be, can I make it two?
Okay.
Okay. So the two messages would be trust your gut. If something doesn't seem right to you, speak up. And if you have, especially this is true for people with chronic illnesses, find a community. You've been diagnosed out of the blue with something terrible. There are people who have been down this road before you. They are on social media. You can find them. I don't mean to, you should trust all of them, but find them and learn what they have learned. Pick and choose what you want to believe, but learn, but get with them and find out what they have learned.
Excellent, excellent. I want to ask Jacqueline to join the Zoom. She's been awesome with the logistics and getting us organized for today's discussion. I just want to thank her super quickly. And Jacqueline, do you mind taking over some of the Q&A from the audience?
Sure. Thank you, Eric and Elizabeth, for the fabulous discussion so far. I'm sure I'm not the only one, or our entire audience have learned a lot and taken really powerful and inspiring advice from both of you. So I'll turn to our first audience question. Um, Elizabeth, how, how do you balance the need to share impactful, often heart-wrenching stories while respecting the privacy and dignity of the people involved? Two-part question. What systemic changes do you think would make the healthcare system more patient-focused?
So the first part is easy. We only, I mean, and Eric, I know has the same, does the same thing. You only share the experience of someone who wants to share their experience. You never, out someone or, force someone to tell their story. You're always asking people. And many, everyone's different. Some people really don't want to tell their story, and some people really want to tell their story. So it's all about listening to the patient and seeing what they want to do. As far as systemic change goes, there was this group that I wrote about a couple of times called Sorry Works. And it's a group that encourages hospitals where patients can come forward if they feel like something has not gone right in the hospital and ask for there to be a review and ask for several voices to be included. And it's called Sorry Works because this gentleman had had a death in his family from a hospital error. And he said, sorry means a lot. And I think that more efforts like that, more programs like that, and I understand there's all sorts of litigation reasons why these things don't happen, but he made this group work, and I think that could be an important change that could be made. It's almost a form of an ombudsman's unit, but it has a very formal process that patients can go to when they feel like something's gone wrong.
Great. Thank you, Elizabeth. So for our next question, I like this one. What would Elizabeth change in the medical system if she had a magic wand?
Oh, wow, that's a great question. I think that what I just said. Now I can't change, the fact that, there are lawsuits and doctors get very, I mean, I'll give you an example. If in my situation with my oldest daughter, I wish that someone had just said to me, this was not good. This should not have happened. You shouldn't have gotten that sick. Let's talk about what happened. I wish if you've given me a magic wand, so that's a lot of power. And I would say that what I would do is make it so that when something bad happens, that hospitals and doctors feel okay talking about it and going back and reviewing it in the same way that when there's a plane crash, the FAA has a review of what happened. That should be happening with not just medical errors, but when there's an outcome that isn't what it should have been. And I know doctors have said to me, oh, we have M&M rounds, morbidity and mortality rounds, and that's when we go over this kind of thing. Well, that's just you. It should be gone over with the patient as well.
Great. I wholeheartedly agree with you with that. As you mentioned earlier, that doctors, of course, they make mistakes. We're all people. So on to our next question. kind of related. So how can we as patients encourage people to share their stories as part of their healing journey?
I think patients are very, very enthusiastic for the most part about sharing their stories. I mean, you do get people, of course, who don't want to, and that should be respected. But for example, the woman who I wrote about in the Washington Post a few weeks ago, she was actually in tears as she was telling her story. And at first, I thought it was because of what she'd been through, and I think it was in part that, but it was also in part because of happiness that she got to tell her story and hopefully help another woman avoid what she went through. So I think that these stories should be told and should be told in an organized way that can be easily accessed, and they should be encouraged.
Great. I think I only have time for one more, and I'll turn it back to Eric. Um, so this person in the audience is asking about trust. What is our message to patients? How do we balance prompting questions versus encouraging trust in healthcare as a whole?
I kind of divide that up into two different sets of circumstances. One is all the planned care that you get, your annual physical or your annual GYN visit or whatever. And that is to choose your doctors very carefully. And don't be afraid, like I did recently, to just stop going to a doctor who you feel like they didn't take your questions seriously. So I think in that situation, that's how you can handle that. In an emergency situation, it's different because you're just showing up at the hospital. And so I think in that situation, you just have to you have to trust these people to a great extent, but you, or if you're sick, the person who's with you has to always be thinking, what questions should I be asking? What should be happening now? What am I expecting to happen? Has it not happened? And I think that that's very possible to do without really angering the people around you. And if push comes to shove, sometimes you do have to make people angry. That does happen.
I agree. And I feel like now for doctor's appointments with me, I always come prepared with questions because sometimes they go quickly and you want to not leave that
Yes,
appointment feeling.
for sure. For sure. Write them down. Yeah.
Okay, well, thank you, Elizabeth, and congratulations on your
Thank
award.
you
I'll
so
turn it
much.
back
Thank
over
you.
to Eric.
I love that. I'm gonna start bringing notes and specific questions. It's an intimidating time to be in that little cold room sitting on the paper table. So I think that's really good advice to write down your questions and be prepared. I want to thank you guys for joining us. Elizabeth, you're the best. Congratulations. We really look forward to honoring you and giving you your award in person at the award ceremony on March 12th later this year. One quick announcement before we end the meeting. If you are a Research America Alliance member organization, please join the first Alliance member-only meeting of 2025. It's going to take place over Zoom. Mary and Leslie from KDCR Partners will provide a DC update and the 2025 policy and advocacy strategy session that got off to a productive start during last month's meeting will be continued to be discussed. If your organization is part of Research America Alliance, be sure to email Jacqueline to receive the Zoom registration link. She's going to put her email in the chat for you guys. I just want to thank you all for joining us today. This discussion was really empowering. The empowered patient is the way to go. I think that should be the theme of 2025 in honor of Elizabeth. So please be sure to register for future discussions, and I hope they're as great as this one was. Thank you so much.
Thank you, Eric, and thank you, Jacqueline.